Urologist from the New York metropolitan area, continuing my series of urology consults. This one is entitled Renal Cysts, Kidney Cysts. Renal cyst is a very common finding on imaging studies. Essentially, it is a small sac that is located within or attached to the kidney, and it is often found on imaging studies of the kidney. They are usually not symptomatic, they are not dangerous, and they are, once again, typically discovered incidentally on abdominal imaging studies, whether it be an ultrasound, CAT scan, or MRI. They are extremely common. Approximately 25% of adults over age 40 have a renal cyst, 50% of adults over age 50. They are variable in size, ranging from the size of a pea to as large as a cantaloupe. I have been a urologist in practice for approximately 22 years, and in that time period I have operated on 2 people with simple renal cysts. They were both very thin women with huge cysts, actually causing a physical deformity as much as does a late-term pregnancy. So, simple renal cysts. The vast majority of these are in this category. They are essentially spherical, thin-walled, and filled with a water-like fluid. They have the appearance of bubble wrap. They have no divisions, no septa. For example, the divisions that you would see in an orange. They have no calcifications. They have no solid components. There is no enhancement. That is uptake of contrast on a CAT scan done before and after the administration of intravenous contrast. These are benign. They will rarely, if ever, become problematic or require intervention. On rare occasions, large cysts may become symptomatic by pressing on adjacent organs. However, this is rather unusual, and most do not cause symptoms at all. Ultrasound is an ideal technique for the follow-up of cysts since it is absolutely non-invasive, does not involve a needle, the administration of contrast, nor any radiation. The first image depicts a kidney with a cyst located centrally. The arrow points to it. And as you can see, it is perfectly spherical, has a thin wall, filled with fluid, looks like bubble wrap. The following slide is an ultrasound, and the white arrow shows the rather large cyst attached to the kidney. The following slide is another ultrasound. In both sagittal and transverse modes, in other words, long section and cross section, showing the cysts which are pointed to by the white arrow. The following image is a CAT scan, computerized tomography of a simple renal cyst before administration of contrast and after administration of contrast. The red block arrow shows the cyst. If a cyst is not a simple cyst, it is called a complex cyst. And what that means is it has either a thickened wall, it has a septa, a little division within the cyst, that is. It has a calcification, that is a calcium deposit somewhere in the wall, or it enhances with contrast. The final slide shows the Bosniak classification of renal cysts. Dr. Bosniak is quite famous for his renal cyst classification. Essentially, cysts are classified as grade 1 if they are benign simple cysts, grade 4 if they are malignant cystic masses, grades 2, 2F, and 3 are intermediate. 2, for example, is a benign cyst that has a few hairline septa or perceived enhancement or fine calcification. 2F is a cyst that mandates follow-up. A class 3 cyst is an indeterminate cystic mass that has thickened, irregular, or smooth walls or septa in which enhancement is present, and these often, if not always, need to be explored surgically to determine the underlying cause. For more information, you can go to our website.